We're back on the Morning Brew with Friends. We're here with Dr. Wayne Kuang, the CEO and founder of MDforMen, and all month long we've been talking about men's health because this is Prostate Awareness Month.
Yeah, Prostate Cancer Awareness Month, and we talked about guys between 55 and 69 getting themselves checked out.
And we can't talk about it enough in some ways, I think, because it is a thing that is a message that a lot of guys, it does seem to go over their heads.
Yeah, and it's the second leading cause of cancer in guys, and one of 7 guys
What's
are
the
going to
first
get
leading?
it. I want to say lung.
Oh, I could see that, lung or heart disease or something like that.
Yeah. So, so yeah, it's something that's really important that guys talk about, and we touched on prostate health and guys trying to be proactive about that and seeking care before it's too late. Your kidneys fail, or you can't pee at all anymore, and things like that.
That sounds horrible.
Yeah.
That's inspired me to make sure I get all of my exams. One of the things, we talked briefly about it last time you were on, though we were talking about the testosterone side of things, because that is the thing, you hear all the radio commercials and the guys are like, are you feeling down? Are you feeling bad? Are those really symptoms of low T, or is that just symptoms of being lazy?
So unfortunately what's happened is that the communities, men in the community have gotten far more advanced in the medical field, and they've been doing things without the appropriate monitoring.
Okay.
So for example, MDforMen, guys, people go out and get their thyroids adjusted, right? Low thyroid, high thyroid, and they go on replacement supplements for the rest of their lives.
Right.
Testosterone is just another hormone, and at MDforMen, I am not trying to make guys 18. I am not trying to make guys supermen.
You're not trying to make us look like Arnold?
Like me.
Right, yes.
Exactly. No, but it's really important that we understand that every guy's built differently. Our thermostats are set differently. There's no way my testosterone level is the same as where it would need to be for Shaquille O'Neal.
Right.
We're just 2 very different people, different sizes, different masses, different activity levels. But every guy, it's about how do we find that sweet spot that works to help grease the wheels.
So what does happen in that? 'Cause so like as you get older, does your body just stop producing testosterone, or does the testosterone become less effective?
So basically, as men, it's part of the aging process.
Right.
We talked about we talked about women going through menopause and men going through menopause and andropause, and there's a slow decline. But probably around by the time we're 40, about a quarter to a third of men are starting to have potentially symptoms of low testosterone. We talked about fatigue, low libido, problems with their erections, maybe having problems putting on muscle mass or strength, buildup of fat around the trunk.
Right.
But there's all the other health issues. For example, it's important for bone density. So there's a lot of guys who are 85 and they fall over and they break their hip.
Right.
Sometimes it's due to low testosterone levels over a long period of time. And so with testosterone therapy, we're just trying to grease the wheels, kind of help guys have a better quality of life, improve their health. We're not trying to jack them up. Right.
That way, when you're 85, you fall. You may get bruised, but you're not going to break the hip.
Yeah, exactly.
Right.
And it's very interesting from my experience. Testosterone actually has been very helpful for some men for chronic pain. I've had some guys, I've gotten them off antidepressants.
Wow.
Mood stability, mental focus. I've had guys come and say, I'm kind of in a mental fog, having problems focusing.
And that's because they're missing that one critical thing that they've been used to their whole life.
Right, or just adjusting it. But it's very important also that we understand that there's many reasons why you could have fatigue. Right. So it's just one element, though, and we work interactively with their primary care provider saying, hey, we're working on this, but it could also be sleep apnea, it could be your thyroid's off. So how do we start that dialogue with guys? And it's really important, especially now, but we also monitor things because it's got risks.
So this is something maybe just because I'm getting to that age where I'm starting to pay attention to these commercials, maybe.
Yeah.
But one of the things is, it seems like it's a newer treatment. Only in the last few years have I really heard about people talking about low T. Or has it really been something that's been around for a long time that people just didn't talk about?
I agree with you there. What happened is that also that I think there's a little bit of embarrassment or shame. Oh, I'm on testosterone. Guys don't want to. Oh, I'm less of a man. That type of thing.
Yeah.
But it's something that needs to be done responsibly, and we're starting the dialogue here at MDforMen in the community, talking about, hey, you get your thyroid checked.
Right.
You get it supplemented.
Right. Might as well get everything else checked.
We talk about hormone replacement therapy in women.
Right.
Why don't we talk about it in men?
Why don't we?
Once again, because we're scared. We don't.
Yeah, I don't want to know. I am that guy. Like, I don't want to. Like, I go to the doctor and I'm like, my elbow hurts, and don't look at anything else. Don't just like this one thing. I don't want to know anything else.
Don't send me to the urologist for the finger.
Right. Right. That's exactly.
No, but it's important that we responsibly look at it because there's risks involved.
Yeah.
You know, you can make your blood too thick. The FDA just came out with a warning saying, look, it may increase your risk of heart attack and stroke.
So you have to balance
clots in your legs,
it.
Clots in your lungs. You could have, you know, issues with worsening prostate cancer, making it harder to pee,
so
sleep apnea.
How much of your business is this? Is that like 50% of your business, 20% of your business?
That's about 20%, 25%.
Yeah.
You know, it's not a huge part of my, you know, as what I do with the no-needle vasectomies, testosterone erections, prostate health, prostate cancer screening. So I probably about 20%, but I think it's an important part.
Yeah, and then what part of the business is the little blue pill prescriptions?
Probably another 20. It's probably, yeah, it's somewhere in there, 20-25%. Yeah. And I think that's a really important one because guys have been, you know, we're all as a society moving towards an improvement in the quality of our life.
And that's what it's about. It's not necessarily about fixing just one thing.
Sexual health is huge.
Right.
It affects it affects our self-esteem. Right. It affects our relationships. I mean, I had a guy who put a penile implant in, and he was really locked into his self-esteem, was tied into his sexual health and his sexual performance. And it really helped him in his relationships.
And he felt much better afterwards.
Yeah, I mean, you know, guys, we're just that way. We're wired biologically that way.
Right.
And so I think guys are really looking for ways to improve their quality of life. And it's not just about living longer anymore. It's living better as well.
Right. So in your case, that means, well, the testosterone's huge. But how do you coordinate that with someone's primary care doctor or with their physical therapist or with even maybe their physical trainer? Personal trainer?
Well, it's just really important that we always communicate, whether it's through correspondence or just making sure, for example, before we start anyone with testosterone with a history of heart disease or family history of heart disease, make sure your cardiologist thinks that, okay, where are you at in the holistic side of your health?
Right.
And make sure it's just one piece of the puzzle for every guy. And we talked about from your mind, body, and spirit.
Right.
And, you know, we're just touching on one part, but other parts are just as important.
Right. In the, how closely is a man's mind tied into the rest of his body? When we talk about this stuff too, you know, we talk about how you, what's the word I'm looking for here, but how you can integrate all of it together. You know what I'm saying? And the idea of, is it mental or is it physical when you start having these problems? Or is it kind of all of it together?
Well, I think the first step for any guy or anyone in general is being able to face your fear about your health. It's something you need to address, and especially for guys, because we're just not used to getting pap smears, pelvic exams, having pregnancies, and so forth.
Right.
That's the first step, because once you identify the self-awareness, that's step number one. Because once you're self-aware enough to say, hey, look, I need to make my health a priority, and as much as I don't want to get that colonoscopy at 50, get the finger wave when I'm 55, and see that Dr. Kuang guy at MDforMen, it's an important part of who we are. And as we begin to face those fears, right, embrace them and move us forward, it sets us free and allows us to address all parts of our health, mental,
and then we can start looking at all of it as a holistic part of your whole body.
Yeah, but it's really facing, embracing, and moving through your fears.
Well, we've loved having you on for the month. And remember to get your prostate checked if you haven't already.
Yep, prostate cancer awareness, and we talked about that. And no-needle vasectomies, testosterone, erections, and all that will help you out at MDforMen.
I love it. Thanks, Doc.
My pleasure.
We'll be back in a couple of seconds. It looks like the guys from the Gladiators and PAC are here to talk about their new partnership on The Morning Brew with Friends.